For every hour, 120 Filipinos per million population contract a kidney disease. In fact, there is a constant rise in the prevalence of new kidney patients in the country since 2002, and in 2021, it was the 11th cause of death in the country. Despite the data of new kidney patients over the years, the country only has the National Kidney and Transplant Institute as the sole medical facility that is specialized in renal care and transplant that provides affordable services. People all over the country, especially the financially challenged ones, face problems in accessing it as it can only be found in Quezon City. Almost 90% of kidney patients are located outside NCR. Among the administrative regions, Central Luzon has the greatest number of kidney patients after it. However, there are only 4 public hospitals in there that can provide basic and affordable renal care. This is why Central Luzon Kidney and Transplant Institute is proposed to contribute to distributing the public renal and transplant services to the Filipinos. However, is it enough to ensure the well-being of the kidney and transplant patients? Let's first recognize their experiences as well as those of the people who support them, the health workers, to provide a supportive, therapeutic environment that will create harmony in the facility. Kidney patients are prone to mental health issues because of their illness and experiences as patients. Transplant patients, on the other hand, experiences stress during the preparation and recovery stage of the operation, while health workers undergo stress because of the nature of their job and their working environment. Others are related to motor and sensual functions of the users affected by their medical conditions. Therefore, the problem of the project is concluded as, how will the proposed specialty hospital architecturally address the challenges faced by kidney patients, recovering transplant patients, healthcare providers, and other users towards a therapeutic environment following a wellness supportive design approach? The researchers should also identify the considerations, the architectural strategies, and the spaces and the elements specific to the kidney patients, recovering transplant patients, and healthcare providers. The study is justified through the following. A qualitative research approach was used to conduct the study. The literature reviewed and the case studies primarily focused on the target users, their environment, and the wellness supportive design theory and their application, while surveys and interviews were done on healthcare providers and kidney patients. Among the provinces of Central Luzon, Pampanga was chosen because it has the most number of kidney patients to population ratio. San Fernando City was the chosen city for the same reason. The city is also the regional center of Central Luzon. It is a gateway to different provinces of the region through its regional transport hub. There were 3 candidate sites for the CLKTI, which are the following, and through the site criteria, Site C was selected. It is located in Barangay Baliti, and it is accessible from regional government offices like Bangko Sentral Pilipinas and DPWH Region 3 Office. As a specialty hospital, it is important that the site is accessible from other hospitals as well, just in case a patient from the latter might need an immediate specialized care. Such hospital includes Mother Teresa Calcutta Medical Center and the Sibilian Memorial Regional Hospital. The site is also accessible from SM Telas Batagan, a famous mall in the area. It is highly accessible via jeepney, tricycle, and private vehicles through the MacArthur Highway. It can also be accessed by the near Mexico Pampanga Toll Plaza and jeepney coming from Angeles City and San Fernando City SM Downtown. A drop-off for PUVs were placed in front of the emergency department for easier access. Like most of the northern part of San Fernando City, the site does not experience flooding, volcanic hazards like lahar and debris flow. However, like the rest of Central Luzon, it is not exempted from earth-shaking hazards, therefore seismic-based isolators were used. The site has a rich vegetation on its rear end and frontage, and row of trees line the road. It is generally flat while its natural drainage goes inward. Therefore, the project included stormwater management systems such as permeable pavement and bioswales to avoid the accumulation of water. Most of the noise it could receive would come from a neighboring university and the road. Plantings that adorn the site and the building shall help in creating a white noise that will mask the unpleasant sounds once it rains. Because of its orientation, bigger sunshades are placed on areas that receives the late afternoon sun. Trailing plants were also used for the same reason. The project shall utilize solar panels for emergency power as well as a rainwater harvesting system for maintaining the plants. The target users of CLKTI were identified using the Philippine Renal Disease Registry from 2017. The data from there were projected towards 2035, 10 years after the establishment of the proposed hospital in 2025. With the data, the researcher was able to derive a need for 316 beds. Kidney and recovery patients and health workers experience problems influenced by their illnesses and their environment. Space shapes our behavior and our ability to live life. It is interpreted as an environment that can influence a hospital user's perception and behavior towards a place that is comfortable and efficient for health workers and patients. The design concept is called purifying vessel of life. It is derived from the function of the kidney to purify the toxins in the blood. Patients, health workers, and other hospital users are intoxicated by the physical and psychological challenges they face that affect their healing and quality of life. Like the kidney, the hospital serves to purify the said toxins with the aid of architecture and well-supportive design theory. Like a clean blood, the users of the hospital will be able to create a harmonious relationship with the facility. Wellness supportive design is used to approach the challenges faced by the user. It is a theory stating that the presence of sense of control, social support, and positive distractions to patients and other users of a healthcare facility in their physical surrounding helps in stress reduction, thus influencing positive medical outcomes. A psychosocially supportive environment aims to facilitate empowerment of unprompted social interactions and social support through the built environment. Positive distractions and access to nature is the interference of someone's attention through elements that are pleasing to the senses and presence of nature. Sense of control is the ability of the self to stimulate wellness through giving it an environment wherein it can practice its personal autonomy effectively. From the frontage, the visitors are welcomed by a commercial area in the mini garden park. This helps in setting a socially supportive atmosphere for the incoming patients. Here, patients can buy needs such as food before attending their appointments. The mini garden park features a garden that has artworks and patients' testimonials. The emergency department is also near the site's entrance for easier access. Once in the building, the patient is welcomed by the lobby that serves as a node for multiple areas in the facility. It is designed to make a visual impact by looking like it is one with the green outdoor environment. To its left, found are the frontline offices in the outpatient department. To its right are the emergency and the ancillary departments. To its front is the courtyard that connects all the facilities on the ground floor. Kidney patients are usually weak and prone to fainting when walking for great lengths. The courtyard helps in reducing the walk needed in traveling to other areas on the ground floor, which improves their sense of control. All indoor waiting areas have seating that faces each other. Lighting fixtures are low to mimic a small space that prompts interaction. Interiors are accented with warm to neutral colors featuring big LCD screens where animations and cues is projected. Entertainment areas are provided as well. The courtyard aims to induce a psychosocially supportive environment by providing patients a positive distraction and access to nature. This acts as a centralized outdoor waiting area covered with trees and plants. The sound of the bamboos in the fountain shall serve as a positive distraction and mask unwanted noises. On the other end of the courtyard is an outdoor rehabilitation area for renal rehabilitation therapy. It has a place for jogging, yoga, and physiotherapy exercises. This is the quietest part of the courtyard, therefore gazebos and chairs are included for relaxation. On the second floor, the dialysis department is located. For assistance and distraction from anxiety, patients prefer having a companion during their treatment. That is why the dialysis cell was designed to provide a space for both the patient's companion and the nurse. It features a television and counters where they can put their belongings within the reach of their hands. These are positioned in a way that patients can observe others in the outdoors with plants, which according to them lessens their anxiety. The administrative department is located on the second floor as well. Same floor on the other wing, the surgery, delivery department, and the ICU is located. Every recovery room here have the views of the outside as well as an immediate view to plants. The study says that this influences the patient's healing to become faster. Surgery patients develop anxiety prior to the day of their operation. Therefore, a family waiting room is placed next to the pre-operation area where the patient can see them. Major operating rooms are provided with benches where surgeons can take micro intraoperative breaks. The rear end of the building are service areas which connects to the engineering and hospital support services. On the third and succeeding floors are the nursing units which features the solo rooms, 4-bed patient rooms, and the pay patient rooms and the solarium. The patient rooms are designed to provide patients a psychosocially supportive environment, sense of control, and positive distraction and access to nature. Each patient rooms have views to the outside. It has a huge windows with jalousie panels that give the patient an option for natural ventilation. To protect the patients from the harsh sun, flaming plants are used as sunshades. This way, the patients are given immediate access to nature while enjoying a comfortable hospital stay. To improve the sense of psychosocial support among the visitors, a cozy and a home-like environment is introduced. This is done using patterned wallpapers, picture frames, and lamps, which are common sights in bedrooms. Kidney patients are sensitive to light, therefore ambient lighting is encouraged. A lighting system that mimics the time is incorporated to maintain their circadian rhythm. A green solarium in form of a bridge is included to act as a place for interaction and rest for patients and health workers. To lessen the walking by healthcare providers, clean and dirty linen drop boxes are integrated in every rooms. This way, changing and disposing linen is way easier. The layout of the patient rooms around the nurse station. This semi-radial layout improves the sense of control of nurses because it eases patient monitoring. Observation windows on each room also serves this purpose. This layout allows the nursing units to be connected to one another, thus making the exchange of services easier. The hospital made use of the centralized nursing units. Each has a dedicated nurse lounge with reclining chairs so they can take a nap and have interactions with their colleagues. Their stations include a shaft where natural light comes in. This is also used for rainwater harvesting. In times of emergency, nursing units in Building A can be isolated. The rear entrance to the building can be enclosed to ensure that infection is contained. On the northwest of the major building is a parking area that is paved between pavers. It is covered by pergola to combat the urban heat effect and create a visual impact for the users. On the rear part of the site located is the multipurpose gymnasium that can also be used for emergency medical situations, workshops, and the MRF. The access to the MRF is through the service road. The service road has a buffer that separates the main building to the road. The zoning of the departments and spaces in the project is designed to minimize noise and prioritize spaces that demand for a quiet environment. The spaces that are more open are located underground and it gets private as it gets higher. To better visualize this statement, let's watch a walkthrough. Synthesis of the findings and the wellness supportive design, Central Luzon Kidney and Transplant Institute shall be a harmonious healthcare environment that provides positive experiences, wellness, and contribution to a greater quality of life for its patients and staff.